So what is this acute coronary syndrome? So we all know the spectrum, so nothing new on this. So ACS spectrum, this part of the spectrum we have unstable angina, and that other end of the spectrum we have ST elevation MI, and what is left in between is non-ST elevation MI. Okay, so if you ask me what is the definition for an unstable angina, so this is very, very important, guys. See, because whenever we ask our medicine postgraduates who come for rotation, so they diagnose unstable angina, but if you ask me what is the definition for unstable angina, nobody comes up with a good answer. Okay, so this is important. So see, in the era of high sensitivity troponins, so this subset has been crushed to the lowest incidence possible, because even a small or slightest myocardial injury we can pick up with high sensitive cardiac troponins. So it's very, very unlikely if the patient has a myocardial injury and we are not able to detect troponins. But this subset has been traditionally described, and we still see patients with unstable angina also. So what is unstable angina? So it's myocardial ischemia at rest or with minimal exertion, So in the absence of acute cardiomyocyte injury or necrosis, whatever you want to call it. Okay, so this is the definition. So because there is no cardiomyocyte injury or necrosis, troponins are not elevated, but you have ischemia, so you can have pain. Okay, ischemia at rest or with minimal exertion. Okay, so this is characterized by all these 3 classical findings or 4 classical findings. What are they? So you have prolonged angina lasting for more than 20 minutes. So, or it can be a new onset angina, recent onset angina. Okay, or angina that is increasing in frequency, or longer in duration, or lower in threshold. So very beautifully written, no? This I have taken from the ESG guideline only. So lower in threshold. Okay. So this is the definition of an unstable angina. So it is a myocardial ischemia at rest or with minimal exertion in the absence of a cardiomyocyte injury or necrosis. So it is characterized by a prolonged angina more than 20 minutes. There can be a new onset angina or a recent onset angina, and angina that is increasing in frequency or longer in duration. Say for example, this patient had angina lasting for, say example, 2 to 3 minutes. Okay, now this patient has got angina lasting for 15 minutes. So then again this criteria is fulfilled, longer in duration, and you have low threshold angina. Previously this guy walks 2 flights of stairs and he gets angina. Now even with 1 flight of stairs he gets angina, then it's an unstable angina. Okay, or any angina that occurs after a recent episode of ACS. This guy had a angina, this guy had an MI, for example, 3 months ago, 2 months ago. Now he again presents with an angina, or 2 weeks ago he had an MI, now he again comes with an angina. So all these are grouped as unstable anginas. Okay, clear?